Hi Sarah. Thanks for coming in to talk to me today. How are you feeling?
Hi Frank. I'm feeling a bit anxious as usual.
I'm sorry to hear that. I'd like to talk a bit more about your anxiety and how to help manage it. I know you've mentioned before about feeling the need to perform certain rituals before leaving the house. Can you tell me more about that?
Well, it's like I can't leave until I've checked everything multiple times. I have this fear that something terrible will happen if I don't do it.
That sounds really distressing. It must be exhausting to feel like you have to go through these rituals every time you leave the house. Can you describe what these rituals involve?
Sure. Before I leave, I have to check that all the appliances are turned off, the doors are locked, and the windows are closed. Then I have to touch the doorknob a certain number of times before I can actually leave.
It sounds like these rituals are taking up a lot of your time and causing you a great deal of distress. Have you noticed if they're getting worse or having an impact on other areas of your life?
Yeah, it's getting harder to leave the house, and I'm often late for appointments because I have to go through these rituals. It's starting to affect my job and my relationships too.
That sounds very difficult for you. It's important for us to find ways to help you manage these symptoms so you can lead a more fulfilling life. Have you ever tried any techniques to help reduce your anxiety or the need to perform these rituals?
Not really. I've tried to just force myself to leave without doing them, but it feels impossible.
I understand. It can be really challenging to break away from these rituals, but there are techniques you can use to help you manage your symptoms. Cognitive Behavioural Therapy, or CBT, has been shown to be effective in treating OCD. Would you be interested in exploring CBT further?
I've heard about CBT before, but I don't know much about it. What does it involve?
You'll be working with a therapist. The first thing you'll do is to identify the goals you want to achieve with CBT, such as cutting down on rituals you perform or managing your anxiety.
Okay. Then what do I do?
Then you'll learn how to do exposure and response prevention exercises, or ERP. These form part of CBT specifically for people with OCD. They'll help you to confront situations that trigger your specific rituals while preventing you from performing the rituals.
I've tried to confront my fear about bad things happening before, but it's never worked. Why would this be different?
This time you'll be confronting your fears slowly with gradual exposure to them. You'll be learning how to challenge irrational thoughts and develop ways to face them without performing your rituals.
How will I do that?
You'll learn coping strategies to manage anxiety, for example, relaxation techniques and mindfulness exercises. You'll also learn problem-solving skills to help you manage stressful situations in a more balanced way. Would you be willing to discuss CBT with a therapist?
Yes. I think it sounds very positive and I'm ready to start making some goals towards better management of my fears.